Have you ever noticed a subtle, nagging discomfort in your body that you just could not quite place? A feeling that starts mild and slowly grows more persistent over time, leaving you wondering if it is just a minor ache or something more important. When it comes to your pancreas, paying attention to these subtle signals can be incredibly valuable. Gradual onset pancreatic pain typically begins as a dull, persistent ache in the upper abdomen, often felt just below the breastbone or slightly to the left or right of center. Unlike the sudden, sharp pain of conditions like acute pancreatitis, this discomfort slowly develops over weeks or even months. It is often described as a deep, gnawing sensation that can sometimes radiate to the back. The reason this pain often starts so subtly and builds over time is due to the nature of conditions like chronic pancreatitis or pancreatic cancer. The pancreas is an organ located deep within your abdomen, behind your stomach. As issues like inflammation or a growth develop, they can slowly press on nearby nerves or cause internal irritation. This gradual pressure or inflammation leads to a pain that initially might be dismissed as indigestion or a minor stomach upset, but it steadily becomes more noticeable and less ignorable. The pain can also intensify after eating, particularly fatty foods, because these stimulate the pancreas to release digestive enzymes, which can aggravate an already compromised organ. If you notice this kind of persistent, gradually worsening abdominal pain, it is really important to consult a healthcare professional. They will be able to perform a thorough examination, ask detailed questions about your symptoms, and recommend appropriate diagnostic tests. Keeping a brief log of when the pain occurs, what it feels like, and if anything makes it better or worse can be incredibly helpful for your doctor. It is also interesting to note that because the pancreas is so closely involved in digestion, early pancreatic pain can sometimes be mistaken for common digestive issues like irritable bowel syndrome or acid reflux. This subtle mimicry underscores why awareness of gradual onset pain is crucial. It is not usually the kind of pain that sends you to the emergency room immediately, but rather one that gently nudges you to seek medical advice over time. Ultimately, understanding what gradual onset pancreatic pain might feel like empowers you to act proactively for your health. Recognizing these persistent, often mild, but steadily worsening signs in your upper abdomen or back, especially if they are linked to eating, is a key step. Early detection and diagnosis are vital for managing pancreatic conditions, so trust your instincts and reach out to your doctor if something just does not feel right. Your body often gives you clues, and listening to them is a true act of self-care.